Good afternoon, everyone. Thank you for coming. I really appreciate you making an effort to be here right after lunch. And I'm really deeply excited for this session. So my name is Pearl Zhitnitsky. I am an associate professor at the University of Minnesota. And in my role, I do a lot of teaching, and mainly of DVM students. And so it is always for me a great pleasure and honor to be the one coordinating this session and the Leman Swine Innovator Prize. So we have had this year the highest amount of submission from students for to come and present, and we had the hard task to select 7 of them. So 7 are going to be presenting this afternoon. They have 15 minutes total, 12 minutes of presentation and 3 minutes of questions. Their ability to answer a question is also part of the evaluation for the Leman Swine Innovator Prize. So please ask questions. I also will ask you to clap and be encouraging. Our students are a little bit nervous, and I know this is a very supportive audience. So please make them feel welcome as they present this afternoon. So here is our list of student presenter, and to kick us off this afternoon, we have Bryn Anderson from the University of Minnesota. Thank you. And this is the challenging part. Oops, for me, trying to find my cursor. Here we go. There you go, Bryn.
Can everyone hear me? Yes. Okay. Thank you for the introduction, Dr. Z. So, as she said, my name is Bryn Anderson. I am a second-year veterinary student here at the University of Minnesota. And this summer, I had the opportunity to do a research project based on evaluating high-dose oxytocin as an intervention to increase immunoglobulin transfer to piglets. Now, to start off our project, we wanted to do some introduction, and as time goes on, we all know the number of piglets per litter continues to increase, and that drives the important question of are our piglets receiving enough nutrients and support in the beginning of their lives? Naturally, the larger litters mean they are more at risk of inadequate passive transfer, and colostrum plays a vital role here. Now, it provides immunoglobulins, but also maternal leukocytes, both of which are critical for passive transfer and the development of the neonatal immune system. But the window's narrow. Mammary tight junctions close soon after farrowing, and that makes it entirely critical for that colostrum intake. Now, some rationale behind it, and as building on what we had just discussed on the narrow window for immunoglobulin transfer, one potential intervention is oxytocin. A high-dose oxytocin may keep those mammary tight junctions open longer, which giving those piglets more time to absorb those immunoglobulins and help improve passive transfer. Now, at AMVC, where we had done this project, they had implemented it company-wide for a while and had seen a decrease in pre-wean mortality, thus showing both biological and production benefits of this intervention. Now, our objective of the study was to evaluate whether post-farrowing high-dose oxytocin influences quantitative Ig transfer as measured by serum Brix values in piglets. Now, to get into the study design of this project, we knew this would have a big impact, and there was multiple pathways that we could go with this project. So we ended up consulting some of my academic professors along with other practitioners. And ultimately, we decided to go with this study design as due to the limited amount of time we had to do it. We based our study down in southwest Iowa at a 2,500 head batch farrowing farm. There, it was easier for me to collect and enroll piglets and sows in that project. We did a systematic control trial, and we did a power calculation with a 90% confidence interval to get to that sample size of 96. In my treatment group, we had 48 sows enrolled. There, at 12 to 20 hours, they received a 4 cc's injection of oxytocin intramuscularly On my control side, they received no intervention, but continued with that routine care. Now, into my study design a little bit more, we did have an enrollment criteria. First and foremost, we wanted a balanced parity, as we believe that was very important to see all size of sows within this project alongside the age. And then they had to be farrowed within 12 to 20 hours, as that was crucial to our project, as that's where we were measuring. Some exclusions we had were the piglets, if they were below 2 pounds or 0.91 kilograms. We did not allow any cross-fostering in my study, along with any sows who had excessively high or low body condition scores. Some additional data records I had taken were the temperature of each farrowing room, how many functional teats they had had, and just the location of those sows and litters. Now, to get into the timeline of my study, we had started at hour 0, which was when I had arrived at the sow farm or started to enroll those piglets. And that's where I took birth weights of 5 randomly selected piglets in each litter enrolled in both the treatment and the control groups. Then fast forward to hour 12 to 20, and that's where those treatment sows received that oxytocin injection of 4 cc's. We then allowed roughly an hour of that to go through their system, and that's when I and a fellow intern decided to start collecting those colostrum samples from both the treatment and control sows via SnapCap tube. After doing that and gathering our samples, we waited another 4 hours to gather that second colostrum sample, and then I also did blood samples via jugular vein in 2 piglets out of each litter, and they were randomly selected. And then finally, at the end of our study, I came back the next day to gather those 24-hour weights of those previously weighed and tagged 5 piglets out of each litter. Now, before getting into the results, I wanted to give some background on why we chose the Brix refractometer as our diagnostic tool. Again, we had reached out to different practitioners and academic advisors to decide whether we should use this or go through a VDL and use ELISA. Ultimately, we wanted to use this as it was simple and field effective, and we had reached out to different dairy practitioners as they use it a multitude of times throughout their job, and they had pointed us here. And then as we were wanting to keep it simple, but still make this project field effective, measuring the total soluble solids by refractometer in piglet serum gives us a Brix value, which correlates well with IgG and serves as a rapid proxy transfer for passive transfer adequacy. It's fast, it's low cost, it only costs us about $250, so we were able to use it, and they still continue to use it, and on-farm compatible that allowed us to evaluate that IG transfer within hours and compare groups efficiently, ultimately making it the right choice for this study. Now to get into my results. This graph shows the average piglet serum Brix value. About 4 hours after the oxytocin window, you can see that the piglets from the treated group had a higher average with an 8.5% when we compared it to the control group of a 6.3%. This was statistically significant with a p-value of 0.007. So even in this relatively small study, oxytocin clearly improved the IG transfer. Now, we wanted to go beyond just the average serum values and ask, were piglets actually achieving adequate passive transfer of immunoglobulins? With the published threshold of 7.9% Brix values, we found that 59.1% of those piglets had passed that adequate passive transfer threshold. When compared to our control group, they had a 40.9%. And then with an odds ratio of about 2, it meant that piglets from treated sows were twice as likely to achieve that adequate passive transfer. This was also statistically significant with the p-value of 0.017, still supporting that oxytocin can improve the proportion of piglets getting enough immunoglobulins early on in life. Now this was interesting. We wanted to include this graph we wanted to see what was happening within the colostrum itself. After about 1 hour of farrowing, the oxytocin or the treatment group had a higher average colostrum Brix value, but it was short-lived as it soonly became similar at the 4-hour window with the control group, proposing that the oxytocin injection may be short-lived but can enhance that and transfer in the beginning. Now, we wanted to include this as we did a secondary analysis with our piglet weights using the de Villers approach. Interestingly, this was counterintuitive to our study as the control piglets ended up having a higher colostrum intake and overall higher birth weights. But we believe this correlates to the flaw in our study as we weren't able to get a balanced parity because of the time constraint and ultimately how sows were farrowing when I was able to enroll. This was not statistically significant. Now, when it gets to my discussions, as I had covered in the results area, as we saw that the oxytocin could increase that passive transfer adequacy and the opportunity for those piglets to receive those immunoglobulins early on within that farrowing time or after birth. We believe this is important as it allows those piglets to get a strong start to that life. As we all know, they face a lot of obstacles going throughout their life, whether it's diseases, movements, or anything else that life throws in their way. This can also be implemented and add a lot of economic value to any kind or size of a producer, whether you're large or small. We had the intention of this project to be simple but yet field effective, and we believed that going through this project and using everyday supplies brought the innovation throughout it to show that we were ensuring a better tomorrow for our piglets and our industry. I'd like to give a big thank you for AMVC Management System for hosting me this summer, along to Dr. Josh Ellingson for his unwavering support and guidance throughout this project and just in general. Thank you to Alvaro Franco, the production manager, for sparking this project, along with Kelly Garrett for helping me with all the manual labor of this project, and lastly to the Swine Veterinary Internship Program and the Morrison Swine Innovator Prize Committee for allowing me this opportunity and facilitating this session. Thank you.
Thank you, Bryn, for your presentation. Do we have questions for Bryn?
Do you think the effect was due to the dosage or the timing of the oxytocin injection?
I believe it's a bit of both. As we've done some research and reviewed some literature points, we had seen the different other research and literature had done different time frames of that. I believe it was more towards the time side of that, as it would, it's known to the colostrum cycle to close soonly after 20 hours. So we wanted to kind of hit it as it was almost closing, but not essentially closed already. So that's where we decided to go with our 12 to 20 hours so we could gauge it.
Did you have any difference in pre-wean mortality between the control and treatment?
So we did not follow that just because of the small sample size and our time limit. That is a future project that could be done, but ultimately we deemed it wouldn't be statistically significant with that size, so we do not have that answer right now.
What percent different pre-wean mortality were they seeing?
They were seeing probably around a 2 to 4% difference. They had mentioned that it was more obvious when they would have when they would have more health challenges with that oxytocin, but on a normal rate it was probably 2 to 4%.
Did you expect any certain parities to have a better response to the oxytocin treatment?
We felt that the mid-range parities, probably those 2 or P2s, 3s would have that a better response. actually excuse myself, the older parodies as they've gone through it more a little bit, and so they've just been weared and teared down, and that's what we wanted to see, but with that unbalanced parody, we weren't able to see that.
Hi, Bryn. Thanks for your presentation. Really great job.
Thank you.
My question for you is, you mentioned that you had some exclusion criteria for the sows.
Mm-hmm.
Did you have any information on if they had any interventions during the farrowing process, if there was any dystocia, or if there was any farrowing induction on those animals, and if that impacted your selection?
Yeah,
Thank you.
per their protocol, they were given Lutalize for induction, and so we just allowed that to happen. But if we had any dystocia or prolapses or any kind of complications that sow was having with farrowing, I excluded her. I ultimately kicked her out right away.
All right, we are out of time for questions for Bryn, so please join me in thanking her for her presentation. Our next presenter this afternoon is Lindsey Britton from North Carolina State University.
Good afternoon. Can you guys hear me? Yes. Thank you so much for that introduction, Dr. Z. I'm Lindsey Britton. I'm a current second year at North Carolina State University, so I'm representing the East Coast crowd here today. But I'm super excited to be here with you today and to talk about some of the research that I had the opportunity to be a part of this past summer. And so that was on dry fog for PRRS and Salmonella inactivation. So to get started, I'm sure many of you are familiar with the supply entry process on commercial farms, but if not, many farms typically use a D&D room system set up. So that's a drying and disinfection room, and that generally revolves around increased temperatures and extended time. So typically you'd bring in all of your supplies into that D&D room and you'd let it sit for about a week with increased temperatures. Unfortunately, as you guys know, farms are prone to breaking things, especially fans. We need supplies and we need them in the farm pretty quickly, and we can't really rely on that 1 week time frame. Several different systems have utilized fogging systems, and so fogging systems allow you to disinfect supplies in a more quickly manner, but generally with commercial fogging systems, they're not quite effective and they're not very consistent across runs. So this presents a huge need for our industry. How can we accurately and consistently disinfect products before they go into a farm, especially when we need to do that in a pretty quick time around method? So this opens the door for utilizing dry fog within our commercial sow farms. Dry fog is different from our fine mist particle that you typically think about when you think about a fogging system. Dry fog is a smaller particle, so it stays aerosolized and airborne longer. It bounces around within the air, making it ideal for our D&D rooms because it's going to hit all of those different contact points that we need it to. Whereas if we're talking about a fine mist particle, that's a particle that comes out of the fogger and it's wet, so it's either going to lose velocity and drop pretty quickly, or it's going to stop whenever it reaches its first barrier. To get into a little bit more about what a dry fog is and how we could use it, a dry fog is a particle size that's less than 10 microns, which is really important because that small particle allows it to stay aerosolized longer. There are certain pre-existing disinfectants we already have here in the swine industry that would be compatible for a dry fog system, specifically those that are hydrogen peroxide based. And so that's similar to what's used in the food industry today. Unfortunately, with a dry fog system, it does rely that you have other supplies in order, like an air compressor and extension cords that you would need for setup. But this dry fog system has a really fast runtime, about 10 or 15 minutes, as compared to other fogging protocols. So with all this knowledge on a dry fog system, how could we actually implement it on farm? That caused us to form our 2 study objectives for my study, which was the first was to evaluate the efficacy of a commercially available dry fog system, the microspray system, in inactivating Salmonella and PRRS virus. And then following up on that first objective, to evaluate contact times at 10, 30, and 60 minutes to truly see if these disinfectants could really inactivate Salmonella and PRRS virus. So with these study objectives, we found our study farm, and that was a commercial breed-to-wean sow farm in southern Minnesota. This farm did recently undergo a PRRS break, and serum was harvested from those PRRS-positive piglets and was saved on farm for utilization with this pilot study. We also made sure that our microspray system was installed within the D&D room of this farm. You can see here our D&D room set up with our metal shelving. In the top, sorry for y'all in the back, it's very far, but our microspray system was installed in the center of the room. Then we have our cardboard boxes that are installed within our room here to replicate a traditional supply entry event where you would have all those shelves full of things. Unfortunately, no corrugated cardboard. And then here on the bottom, we can see our extension cords. And so this was hooked up to our air compressor for our study so that we could turn the system on and off without ever opening our supply entry door to make sure all the particles that stayed in that room and we didn't lose any of those airborne particles. For the study specifically, we utilized 3 different samples. We first used a PRRS serum from a L1C 532 animals that were positive on the farm. We also used a PRRS MLV vaccine, which was the BI Engelvac product, as well as we used a Salmonella TC vaccine, the Enterosol. For these samples, we located them in 3 different areas throughout that supply entry room. So the first area was an open air. That allowed the particles coming straight from the vaporizer to touch the plate, and they did not have any barriers in between the plates and the vaporizer. In the middle, we see our location between boxes. So if you can see, there's a box on the top. So those particles had to go around that box on the top and then go between the 2 boxes to hit those plates in the middle. And so that's what it would be like in a typical supply entry event for us today. We'd have lots of things next to each other. We want to see if it can get in between the cracks. And then finally, our true test here. We have our Petri dishes underneath an open box. So those particles had to come from the vaporizer, go down, go back up into the box, and then finally touch down on the plate to inactivate that material. For the study itself, we utilized 2 different disinfectants. Disinfectant A was a hypochlorous acid solution, and disinfectant B was a hydrogen peroxide with peroxyacetic acid solution, similar to what's used in the food industry. Here we have a quick timeline of how things ran on farm with all of our replicates. We started off with setting up our plates. So that was 1 ml of our serum, 1 ml of our MLV, and then 1 ml of our Salmonella vaccine in our Petri dishes. We spread that Salmonella vaccine around with a clean BBL culture swab to make sure it was covering that entire plate. We made sure our microspray system was set up, primed, and ready to run. Then we ran that system for 10 minutes for each of our runs. Then we allowed our contact time to be observed. So this was our 10 minutes, our 30 minutes, and our 60 minutes. And then finally, we took our samples for submission to the diagnostic labs. Here we can see a quick setup of our disinfectant A runs, our disinfectant B runs, doing them all in the same process at our 10, 30, and 60-minute contact times. Here you can see what it looked like within that supply room just a minute after that vaporizer had been running. And several minutes in, it's a really thick fog, and it stayed that way throughout the entire run period. For our diagnostic testing of our samples that we took, we utilized the University of Minnesota Veterinary Diagnostic Lab to submit our Salmonella swabs for culture. And then we utilized the Schroeder Lab here at University of Minnesota for a viability real-time PCR. This viability PCR is different than a traditional PCR because it only picks up on live pathogens, whereas a traditional PCR is going to look at all of the RNA that's within that sample, whether it be dead or alive. If If you have any questions about this viability PCR, there is a viability portion of the conference tomorrow afternoon. I think it would be great, and Dr. Schroeder would love your questions there as well. Now to get into our results. All the following tables will be set up the same way, with our disinfectant A on the top, disinfectant B on the bottom, and then our positive controls will be listed in the center, and then our final samples that we took from our plates on the far right. So we can see that our disinfectant A failed to neutralize salmonella at any of our contact times, whereas disinfectant B did neutralize salmonella at all 3 contact times in all of the locations within that supply room. And now we're getting into our PERS MLV results. You can notice on this page, there's a whole lot of negatives. So we determined that this MLV vaccine was designed to elicit an immune response within the animal. We want that to be safe on farms, and so it'd be really important to test this vaccine later on in actual serum that's going to keep that vaccine stable for a longer amount of time. And finally, the really exciting stuff, our PERS serum. We've got our disinfectant A results on the top, similar story to salmonella. It failed to neutralize PERS serum at any of the contact times, whereas disinfectant B was a little bit different. It, similar to our salmonella case, did neutralize PERS serum at 30 and 60-minute contact times, but failed to do so entirely at our 10-minute contact time. It's important if you're looking at these CTs that for disinfectant A, where it had no effect, CT was about 30, whereas for our 10-minute contact time for disinfectant B, that CT did increase to 34. So that disinfectant did have an effect on it, just not entirely neutralizing as it did with the 30 and 60-minute contact times. So what did we determine from this pilot project? The first, disinfectant A failed to inactivate PERS and inhibit salmonella culture, whereas disinfectant B inhibited salmonella culture at all of our contact times and inactivated PERS at our 30 and 60-minute contact times. This is great information for us to have as an industry. This could potentially turn around our D&D rooms from a day's process to a couple of hours, where we can get needed supplies into a farm super quickly. So what are the next steps from this study? We'd love to evaluate contact time to determine the best practice. We found that 10 minutes wasn't quite enough, but 30 and 60 minutes were. So where's that sweet spot? We'd like to replicate this study with additional PERS strains, supply room designs, and pathogens, such as PED. We'd also like to repeat with this with additional virus assay work. This worked on farm, but we really like to take it into a lab to get down to the nitty-gritty and see what we really need to do on farm. I'd love to thank Swine Vet Center, Holden Farms, and the Schroeder Lab at the University of Minnesota for allowing me to do this work this summer, as well as the Leman Conference Committee and the Morrison Swine Committee. I really appreciate the opportunity to be here with you guys today. I'd like to thank you for listening and opening the floor to any questions.
Thank you, Lindsey. Any question for Lindsey? We have a couple over there.
Nice job. That was a great presentation. What was the time frame between the end of the experiment and then getting it to the lab?
Thank you for the question. Great question. So we conducted our study, say, on a Monday, and took those samples, kept them refrigerated, and then salmonella was shipped off the next morning. The PERS piece got delayed, so it was 48 hours before it made it to the lab.
And so based on that, would you recommend that after the contact time, the 30-minute contact time, that you then leave samples in your D&D room for 48 hours? Or do you think that they could come in the farm right away?
That's a great question. I think it needs to be evaluated further. Unfortunately, we don't know at what point that PERS virus degraded. Did it degrade actually in the D&D room, or did it degrade because it had 48 hours where it was just on ice and it wasn't frozen? So this, I would be hesitant to say, bring it into the farm. We'd much rather have false positives than we would false negatives in this case. I don't want to break a farm. So I think that's a great question that we should evaluate a little bit further. Try to get those samples immediately to the lab.
Yeah, thanks, Lindsey. So just to be clear then, you weren't using any kind of a disinfectant neutralizing broth then, is that right?
No, sir.
Okay, just want to clarify. And then my question is, when you the placement of your Petri dishes in all 3 cases were upward facing,
Yes, sir.
and so they're exposed to gravity, so to speak. Do you have reason to believe anything in the literature that would suggest that the dry fog, as you described, this very small particle sizes would touch the sides or contact the sides and the bottoms of boxes? Because almost all the earlier work done with fogging, that was the problem, right? It doesn't sort of land on or make contact with the sides and bottoms. But do you have reason to believe that it would in this case?
Yes, sir. Thank you for the question. I think I do have reason to believe in this case simply because our Petri dish was placed underneath that far box on the end where it was upside down. So those particles had to go up within the box to settle on the top of that Petri dish. So it wouldn't be a straight line across, so that they did have to go up farther. But I think that's definitely something that we could look into a little bit more.
One more question.
Great presentation, thank you. My question is regarding those smaller particles and if there are any safety considerations for staff when working with them.
Yes, ma'am. Thank you. That's a great question. So that's why some of the pre-existing disinfectants that are in the industry are not viable to use in this regard. When you break those particles down to such a small particle, it breaks the chemical bonds. And so it changes the structure of those chemicals, and they can be more hazardous to employees. So that's something that definitely needs to be evaluated, and make sure that you're using a disinfectant that is compatible if it's broken down so that it's not hazardous.
Thank you.
We're out of time, so thank you, Lindsey.
Thank you.
Our next speaker this afternoon is Kaydance Hinn from the University of Minnesota.
Hi everybody, my name is Kaydance Hinn. I am a first-year DVM student at the University of Minnesota, and this summer I created an estimation cost calculator to assess the economic impact of Mycoplasma pneumoniae disease. So originally, this was not the first project I was working on this summer, and because of that, this project almost didn't even happen. I was completing various tasks at the Mycoplasma lab at the University of Minnesota, such as lab work like PCR testing, assisting with other graduate research projects, and making websites like you can see at the bottom right-hand corner. That's the Mycoplasma lab website I created. But I was so fortunate to be able to attend a lot of fun events throughout the summer, like the Young Leaders in Agriculture Conference that you can see in the upper right-hand corner. And I was just looking back, and that is Dr. Tom Wetzel. And while we were talking in that picture, we both found out that we were going to be working on this project together. So just a small world in the swine industry. I was then able to attend the World Pork Expo as well, where I ate so many barbecue ribs. But then throughout the summer, the opportunity arose for me to assist with the state's Mycoplasma pneumoniae elimination initiative. So a little bit more about that is that Minnesota really wants to strengthen their movement for swine health. And part of that is different initiatives that they are starting throughout the state. So right now they're working on a Mycoplasma pneumoniae elimination initiative. So part of that creates a lot of different projects like this calculator, which is in collaboration with the Minnesota Pork Board. This initiative is almost 2 decades in the making because elimination protocols have been proven very successful, but they are a very slow-moving growth. And so Minnesota really wanted to make that final push to become Mycoplasma negative in the state. This resolution was just approved by the U.S. SHIP program at the beginning of the month, which I'll go into a little bit more later. So what is Mycoplasma pneumoniae, or Mycoplasma, as I'll be referring to it later on? It is a bacterium that affects swine, and a lot of the times piglets will become infected at birth, but because it is so slow-moving, you won't really see it until that finishing stage. It is characterized by a dry, non-productive cough and a slow growth rate. There are limited resources for our producers, especially looking at the economic implications of this disease, and even more so on that sow farm side, because a lot of people associate Mycoplasma only on the finishing side. And so we wanted to create a tool that would calculate these costs associated with this disease, both on the sow farm and on the finishing end. And so these results would bring awareness to producers and allow for management decision-making with their veterinarians. I was given a lot of leeway with this project, which I really appreciated. The original plan was for me just to do the data analysis portion of this project, and another party was going to complete the physical building of the calculator. But I really wanted to make this project my own and finish it from start to finish. But I had a lot of problems along the way. Like, I had no prior knowledge of how to code. I didn't know anything about finishing swine production, or prior to the start of the summer, I didn't even know what mycoplasma was. And so I had a lot of learning to do along the way. So first of all, as a vet student, I learned and studied what mycoplasma was and how it affected the swine industry, especially looking at the finishing side. And then I created a prototype calculator that I used to understand and envision how the end product would look for our producers. After many rounds of revision, that prototype became the finalized product. So moving on to the data analysis portion, I was provided a partial budget spreadsheet by Dr. Paul Yeske at the Swine Vet Center. I really took this spreadsheet and broke it apart, looking at the production factors and the equations that came with this as well. This had production factors from sow farm all the way to finishing, so it was a lot to take on. I ensured that my definition of these factors were the same as everybody else's. My definition of average daily gain needed to align with what this spreadsheet was showing. I learned what the average values for certain factors were and how mycoplasma affected this. For example, for non-productive days, the average numbers kind of look around 35 to 40-ish days, depending on your farm, if you are negative. This number could go almost as high as 51 if you are a very positive farm. I also identified what were going to be the important factors that we were going to need to get from farmers in order to complete these equations and get them some values back. I completed a literature review in order to further my knowledge of this topic, as well as create these ranges for some of these factors. I utilized a master's thesis from North Carolina State University student Lindsey Britton, looking at mycoplasma's effect on the sow farm level. They compared a mycopositive farm to farms that had just undergone elimination protocols and looked at the differences in those sow farm factors, which, like I highlighted, we really wanted this calculator to include those sow farms in order to push elimination protocols. I also looked at finishing production data from Zwart's farms, looking at co-infections of mycoplasma with PRRS, because as we all know, if you have mycoplasma, the chances of you having a co-infection like PRRS or flu are much greater. So then going into the actual calculator building, like I said, I had no prior knowledge of how to code. I can barely get my computer to turn on some days. And so I utilized AI for guidance on how to do this. We first started with a Google Sheet. This does all the back-end work. So the numbers that the producer would type into the calculator, they show up on this Google Sheet, and the back-end equations do all the work. I then would explain what a simple task was that I needed it to do, and I would receive code snippets that I could input into Google Script, and that would make the physical calculator. I did learn how to code towards the end of this project because I felt like when I was reliant on AI, more issues arose. And so it was easier for me to just do it myself rather than to try to troubleshoot the issues that AI was creating. And then after many rounds of revision and collaborating with so many professionals, we were able to create a finalized product for our producers. So this video will kind of talk about what it would look like if you go through the calculator yourself. So you'll come to this landing page, and it'll talk about what the initiative is, what the calculator is, and it just explains that the numbers are not going to be 100% accurate, so you need to collaborate with your veterinarian. This page talks about where we got some of our data from and these ranges that I've mentioned before. We also had fixed production parameters that stayed consistent throughout the equations. Those are listed there, as well as how these factors can change on varying levels of infection. So once you begin the calculator, you will have 3 operation types you can choose from. You'll have sow farm, wean to finish, and grow to finish. Once you make your selection, you will be able to input your farm's specific data, as well as inputting what your ideal factors would be if you were mycoplasma clean. If you hover over those little pig icons, it'll give you more information on what we're looking for and some ranges that it could be if you didn't know that number based off of your farm. You also can input if you are interested in going to an elimination protocol or if you are currently already doing one. So once the calculator does its thing, you'll have a negative baseline. So this is what a farm is losing out on just on an average day being mycoplasma negative. This mycoplasma scenario that you can see on the left side, those numbers are in addition to your negative baseline. So you can see that mycoplasma is costing you a lot even on the sow farm level. Again, you can hover over those pig icons and it'll tell you a little bit more about what that factor is talking about. You can see at the bottom it has estimation elimination costs. So when I inputted this stuff, I said that I was interested in potentially doing an elimination protocol. And we had a pre-made one that was already set up just to give producers an idea of what that return on investment could be if they were to do an elimination protocol. We also have some additional resources that farmers can use if they're interested in learning more about this project or about an elimination protocol that they would have to work with their veterinarians. So this calculator is live right now on the Minnesota Pork Board's website. They have a Farmers Resources tab, and it will be the first one that comes up talking about Minnesota's swine health improvement plans. Like I mentioned, this initiative was introduced to the House of Delegates meeting earlier this month and has been approved by the U.S. SHIP program and will be moving on to the national level, which is very exciting for Minnesota to really make that final push for elimination of mycoplasma. I hope to include co-infection options like PRRS and flu to this project because, like I said, you're more than likely to have those co-infections if you have mycoplasma. And I also want to add it to more websites, such as the mycoplasma one that I created earlier this summer. So while this project wasn't my first initial project, it was such an amazing opportunity that I was able to create a practical, impactful solution for swine health. This project can be used for economic decision-making and really pushes that advocacy for the state's mycoplasma elimination protocol. I stepped outside of my comfort zone and I learned so many new skills and collaborated with so many professionals throughout the industry and furthered my knowledge and passion for the swine industry. I would just like to say thank you so much to Dr. Maria Peters, Dr. Paul Yeske, and the Minnesota Health Task Force that I worked with to create this project. Any questions?
Thank you, Kaydance. Questions for Kaydance?
Right now, it is only specific to mycoplasma, but I would like to expand it for other infections. And I would like to, when I address the co-infection issue as well, to be able to separate it of this is where your mycoplasma is and this is where your PRRS numbers are coming from. But I think that that would be difficult because a lot of producers might not have that separation knowledge.
Have you had any producers use it and input information to the calculator and then any feedback from them on how that went?
I have not had anybody, specifically a producer, use it from the Minnesota Pork Board's website. I don't have that knowledge or information, but I did collaborate with the Minnesota Swine Health Task Force, and they had producers on their board that went and in the earlier stages looked and played with it and gave me feedback on what we could improve on.
A quick question, Kaydance, about all of this information that the producer is inputting. That is not saved anywhere, right? That is theirs?
Correct.
Any more questions? No? Thank you so much, Kaydance. Our next speaker this afternoon is Seth Reicks from the University of Minnesota.
Thank you, Pearl. Like she said, my name is Seth Reicks, and my research was looking at evaluating the reference range for hemoglobin in boars, and then looking at that reference range and seeing if there's any association with hemoglobin on sperm production parameters as well as libido. Before we get into it, hemoglobin is a protein molecule in the blood. It's responsible for binding oxygen, delivering it to the cells, and that oxygen is then used to produce energy in the form of ATP. Here, iron is one of the components of hemoglobin, and that's what's actually responsible for binding to the oxygen. In the past, there's been quite extensive research done on little piglets and also sows. So they found that in piglets, low hemoglobin levels are associated with a decreased immune response and then also decreased post-weaning growth rates. When they looked at it in sows, they found that low hemoglobin levels were associated with increased farrowing durations as well as an increased occurrence of mummifications and stillbirths. With that, there's been very limited research done with hemoglobin in boars. So that sparked a few questions. First off, what is that reference range? And then we also wanted to know, does it impact reproductive parameters, specifically semen production and libido? So reproductive parameters, that's going to be your morphology, motility, total sperm produced. And then libido is important because that affects the semen supply. Libido is used to determine cull rates and then overall stud efficiency. So with these questions that we asked and in the past research that has been done, we generated this hypothesis that hemoglobin levels may influence boar libido and sperm production. First off, we wanted to know what is the reference range in boars. Once we determine that reference range, then we can move in to see if hemoglobin is associated with sperm production parameters and libido. This study utilized 246 boars that included 7 different breeds. We visited 4 different studs, and while collecting blood, we collected it either from the ear vein via an e-prick, the saphenous vein, or the vena cava. Once you have that blood sample, you load it into a cuvette, and then you put that directly into the HemoQ device, which is what gives you your hemoglobin value. So the first thing that we got to do is grab the boar from the pen, and you put it into a collection pen. Once it's in the collection pen, it gets 5 minutes to mount the artificial insemination dummy. If it fails to mount that dummy, you remove it from the collection pen, put it back up into a warm-up stall, and then it'll receive up to 2 more 5-minute attempts. If it doesn't mount after 3 attempts, you put it back to its home stall, and you mark it as failed to mount. Different farms use different protocols for luteolice. So depending on the farm, they're either injecting it with luteolice after the first failed attempt or after the second failed attempt. And then luteolice is just synthetic prostaglandin that most boar studs across the Midwest and the US in general will inject to increase the chances to mount the artificial insemination dummy. Once the boar actually mounts onto the dummy, you wait for it to begin ejaculating, and then you go in and get your blood sample. And the reason you got to wait for it to start ejaculating is because the flinch rate for a boar who is on the dummy is about 10%, making it a lot easier to actually obtain that sample. Once you get your sample, you put it in the cuvette, and that cuvette goes directly into the HemoQ device, and then within 1 to 2 minutes, you're going to get your hemoglobin value as shown right here. So on the site, we were collecting the hemoglobin concentration, that's in grams per deciliters, the libido parameters, and libido is evaluated by how many times it took them to mount the dummy, whether they mounted it at some point or failed completely, and then also the feed iron content. And then after we get those, we look at PRISM, which is the boar stud software that pretty much all boar studs in the US use, and that's where we got the information on total sperm in billions, percent normal sperm, and that's going to be your motility and your morphology, the age, and then also the breed. So this is answering that first study objective. We defined the reference range in boars, and that's between 13.1 and 15.2 grams per deciliter with an average of 14.2. This is a box and whisker plot showing the distribution of values. This right here, this navy blue box, that is the interquartile range, and that's going to represent 50% of all the data. So we can use this to say If the boar falls between that range, it'd be considered normal. Anything below that is going to be considered below normal, and then all like this dot here below that is going to be considered an outlier or anemic. Getting into that second objective, this is looking at libido. So we found out that boars that mounted on their first attempt on average had a hemoglobin value of 14.1, and those that failed on their first attempt had an average hemoglobin of 13.6. So that's a difference of 0.9 grams per deciliter. In other words, if the boar mounted on its first attempt, on average it's going to have 0.9 grams per deciliter hemoglobin higher than if it failed. This slide is a different way of looking at that same parameter. So it's looking at boars that mounted successfully at some point versus the boars that failed entirely and were never collected. Interestingly, the mean difference between these two groups was 1.9 grams per deciliter, and that was statistically significant with a p-value less than 0.05. So this is saying that if a boar mounted at some point successfully, on average it's going to have 1.9 grams per deciliter hemoglobin higher than a boar that failed to jump entirely. The other parameters we looked at were total sperm, billions, percent normal sperm. Again, that's going to be your motility and your morphology, the age and the breed, and with all these variables we found no relationship with hemoglobin, and all these were p-values above 0.05. So why does this really matter? First off, boars that don't jump, there's a lot of time involved with this. And labor is one of the most important inputs for sperm production. It's one of the biggest costs in a boar stud. So if a boar doesn't jump, it gets 5 minutes. And if it doesn't jump 2 more times, that's 15 minutes. And let's say you have 5 boars that don't jump in a day. That's going to be 75 minutes or an hour and 15 minutes for that worker that you have to pay for 0 semen collected. The next thing is there's higher cull rates for the boars that won't jump. So if a boar won't mount the dummy, you can't collect any semen from them. There's really no value for that boar. So barns are going to use production parameters such as luteolase injections and their ability to mount the dummy to determine if they're going to cull that boar. So even if a boar has really good EBV or high genetic value, if it can't mount the dummy, there's really no use for it, and you're going to cull it. Finally, this one's speaking from personal experience. It interrupts the stud workflow. So when you're working in a boar stud, it is very frustrating if they won't jump. It requires a lot of extra handling. You have to move them around into warm-up stalls. In that case, there's a bigger chance that they're going to fight amongst each other or get let into the same pen. And overall, it just takes a lot more time. And when it comes to hemoglobin, it would not necessarily be unrealistic to test every day. It's a very easy test to conduct. You get it in the HemoQ device. It takes about 1 to 2 minutes to put it into the HemoQ before you get that value back. The next thing that people could do is consider an iron injection. I'll get into that a little bit more on the next slide, but dextran is an iron injection that you could give to pigs, and essentially, hopefully, that'll raise the hemoglobin level, the hemoglobin values for the pig. And the final thing is you could reevaluate boars with mounting difficulties. So instead of just culling them right away, maybe look at their hemoglobin levels. If they're low, consider trying to correct those hemoglobin levels before getting rid of them. So if you're going to remember 3 things from this presentation, here they are. First off, we define that reference range. That's between 13 and 15 grams per deciliter. Libido was strongly linked to hemoglobin. So boars with higher hemoglobin, on average, had higher libido. And then lastly, hemoglobin was not linked to sperm production parameters. So next with this research, we want to look at dextran injections. So we'd look at boars that were struggling to mount, measure their hemoglobin. If it's low, we would consider a 25 milliliter injection of dextran to see if that would first off increase the hemoglobin levels, and then would that also increase their libido. With that, I would like to thank Reicks Veterinary Research and Consulting, specifically Dr. Darwin Reicks and Dr. Megan Hood for helping with the project, Pharmacosmos, Dr. Chris Olson, Dr. Wesley Lyons for supplying the HemoQ devices, and finally the University of Minnesota, Dr. Cesar Corzo and Dr. Igor Popolowski for statistical guidance. With that, I'll open the floor to any questions you might have.
Thank you, Seth. Any question for Seth?
Did you happen to track or notice any difference on the breed of boar? If there would be a difference in their normal range, I guess, for the hemoglobin?
Yeah, so she asked if there was a difference with hemoglobin within the breed. We looked at that. One of the hard things with that, we had 7 breeds, but for some of those, like Mishan, we only had 3. So it's hard to look at that. But for the breeds that we did have a lot of data, for example, 337, that's a synthetic line, and then the Durox, there was no difference between hemoglobin. Does that answer your question?
Yep, thank you.
Yeah, thank you, Seth. So, yeah, my question was going to be related. I was thinking age, though, and other potential confounders here that may affect the libido in boar that may also affect hemoglobin.
Yeah.
Anything else you can think of?
So he's asking about co-founders. That was one of the questions I had as well. So I did a analysis where, for age, for example, I took the first quartile to kind of eliminate the age variance, and then I'll look at those parameters as well. And same with breed, I'll look at just the Durox, and the trend was the same as when I looked at the data set as a whole. So that was one way that I did it. It's called sporadic, or I forget the statistical analysis name, but that's how I went about it to try to eliminate those co-founding variables, if that answers your question.
Nice job. For your hemoglobin results, do you think location of where you got the blood would influence your hemoglobin? And then also, whether it's venous or capillary, do you have any recommendations for building your references?
So she's asking about the difference in like the location. From literature review, there's been a lot of literature on this. The site does not affect the hemoglobin concentration. My personal recommendation is the leg vein, only because in a boar stud, they're collecting blood from every boar that's on the dummy anyways for PERS analysis. So if you have a syringe full of blood that you're going to submit for PERS, you can just use a little bit of blood from that sample, and you can use that to measure the hemoglobin concentration.
Nice job, Seth. Curious if you did any repeatability analysis on the HemoQ on an individual boar, and also on the libido scores. Is that consistent for a given boar day to day? I'm guessing the hemoglobin isn't highly variable day to day.
Yeah, he's wondering about the variability, I guess. I did. So for multiple boars, I would take 2 samples, measure them both. In some cases, I would look at different sites. So I'd look at like an ear prick versus a leg vein, and I was seeing very consistent results on the HemoQ device. Maybe within 0.1 or 0.2 difference, but overall it was very similar. What was the second part of your question? Libido. Oh, yeah, libido. So libido, for the most part, I was looking at the database, looking at luteal lice occurrence, and usually the boars that are struggling to mount have higher incidence of luteal lice, and then also the ones that have not mounted in the past were the ones that did not mount during the study. So it was pretty consistent during the study.
I actually have one quick question, Seth. Regarding your reference range, how many boards did you have, and also any selection criteria or exclusion criteria for those boards included?
So with the exclusion criteria, we didn't have any. So we were first come, first served. So the boards that are coming up on that collection day to be collected, those are the ones that we were taking samples from. What was the other part of your question?
And how many did you have in your sample?
60 per farm. Usually, I think a few farms we did more than 60, 246 total.
Okay, thank you. Additional questions? No? Thank you so much, Seth. Our next presenter this afternoon is Rachel Kontz from the University of Minnesota.
Good afternoon. afternoon, everyone. My name is Rachel Kontz, as Dr. Z mentioned. I'm a third-year veterinary student here at the University of Minnesota. This summer, I had the opportunity to take part in a variety of different research projects, one of them being titled Caught in the Trough, the Interplay Between Mitigants and Feedback. So we know that feed is being increasingly recognized as a vector for the transmission of many common swine diseases, as some of these viruses can even persist in the feed for extended periods of time. Our mitigants have proven to be extremely effective in reducing this viral load, and they're now widely used and implemented in our very comprehensive biosecurity programs on farms. Another dietary-based strategy that we also use to manage disease exposure is through a process called feedback. This is the deliberate oral exposure of gilts and gestating sows to biologic material containing specific pathogens. The goal of this feedback is to induce immunity through a controlled exposure, particularly to pathogens that we know are circulating within the herd at various levels of production. This feedback is usually mixed with our feed and consumed in troughs or feeders, depending on the farm, and it comes directly into contact with our mitigants. Given our increasing reliance on both our mitigants and our feedback as part of our herd health programs, we need to evaluate how they interact together. Specifically, whether our mitigants may interfere with the effectiveness of feedback by inactivating our pathogens before our intended exposure even occurs. So that brings us to the objective of my study, which was to evaluate the impact of feed mitigants on the efficacy of feedback at 3 distinct time points. So I drove to 2 commercial sow farms and collected fresh feed from each bin. Each farm used a different mitigant. At the time of this study, I was blinded to the type of mitigant, but I now know that both were organic acid-based mitigants, one being Liquid Guardian and the other one being Activate DA. These samples were subdivided into 12 100-gram portions in Ziploc bags, and there were 6 for each farm. Each portion was put into the bag along with 200 milliliters of PBS, and that was added to simulate our feedback and feed mixing conditions. And then also to simulate pathogen exposure, we used 2 vaccines, one being Edemavac F18, a common E. coli vaccine, and the other one being BI's Ingovac PERS MLV. This is just a visual aid to show you what my bags looked like. Each picture just represents a different farm. And then on the top, we can see our PERS labeled bags. On the bottom, we can see our E. coli bags. So I broke this study up into 2 different phases, so it was a little easier on myself. The first phase being the E. coli phase. So I took those same 6 bags, and each of them were inoculated with 10 doses of the Edemavac F18 vaccine and then mixed well together. These samples were just maintained in the clinic at room temperature, which was about 72 degrees, and then they were swabbed at 3 intervals post-inoculation, 30 minutes, 2 hours, and 12 hours. These 3 intervals were designed to be possible intervals at which an employee would mix feedback. So 30 minutes being the employee mixed the feedback and fed it right away. 2 hours would represent the employee that maybe mixed feedback, went and did another task, and then came back to feed. And then 12 hours being an employee that maybe made the feedback the night before and then fed it right away in the morning. After I swabbed each of these bags, I put them on a plate and then incubated them for 12 hours. I also inoculated a control plate and incubated that to serve as my positive control. This just shows what my 30-minute time point looked like. The solid plate there is just my control as well, and then the 2 biplates were my 30-minute plates. So moving into the E. coli phase results, at 30 minutes you can see we had significant growth, and then same pattern at 2 hours, and then as well at 12 hours. And then also the E. coli control plate also yielded significant growth. So then, like I said, all 3 time points yielded significant growth. So this suggests that our feed mitigants had minimal to no inhibitory effects on the growth or viability of E. coli, and it further supports the conclusion that the use of these feed mitigants does not compromise the effectiveness of certain feedback protocols that are intended to expose animals to the E. coli antigens. So moving on to the second phase, the PRRS phase, again, I took 6 bags, 3 from each farm, and they each got 10 doses of the Engelbach PRRS vaccine, and then they were mixed together. These samples, again, maintained at room temperature at the same 3 time points, 30 minutes, 2 hours, and 12 hours. I then just took liquid from the top portion of each of the 6 bags and put them into snap cap tubes at each of the 3 time points. These tubes were then just put in the freezer until they were to be sent out for diagnostic testing at the conclusion of this study. I also saved a tube containing only the vaccine and put that in the freezer as well to serve as my control. Then moving into my PRRS phase results, we can see that all tubes tested positive on PCR. So then we decided to break that out on virus isolation, and tubes 1 through 6, sorry for those in the back who maybe can't see as well, but tubes 1 through 6 tested negative on virus isolation, and then tube 7 was positive. This was to be expected as that tube 7 was my vaccine. So again, all PRRS positive on PCR, but negative on virus isolation. And then this confirms that our mitigant would not completely eliminate the virus's RNA, but they are able to compromise it and prevent infection. Bringing both phases together, we can see that our mitigants are contributing positively towards our biosecurity programs, especially since we can see that we prevented the live virus exposure. However, this research does show that the mitigant does eliminate the pathogen, so the separation of the feedback and feed may be necessary, especially when we're trying to target specific viruses. We do, however, need much more additional research to evaluate the efficacy of these mitigants against other pathogens and to further understand their impact on feedback strategies. So I'd just like to give a big thank you to Dr. Rachel Jensen and Eric Cleveringa for helping me at Pipestone this summer, and then also as well to the University of Minnesota and their swine team for continued support, and then the U of M Leman Conference Committee.
Thank you, Rachel. Questions for Rachel? No? So what would be your recommendation for producers when wanting to implement feedback, but with those concerns?
I would definitely encourage producers to look at what pathogens their feedback is specifically targeting. But I do think it's worth noting that if you are targeting a specific virus, maybe consider separating your feed and feedback and double checking what type of mitigant you're using, just to make sure you're not canceling out one of those strategies.
Thank you.
Great presentation, thank you. Are there other mitigants that you would like to look at in the future?
Yeah, I'd like to look at maybe a formaldehyde-based product, but any other mitigants I think that wouldn't be organic acid-based would be worth looking at, because we never know how they may interact differently with pathogens.
Great project. For your, on your E. coli, knowing how that vaccine works and is meant to attach in the intestines, do you feel like there would be a value in collecting live animal samples of animals that have been vaccinated and perhaps on that feed to see if that interfered with the attachment, more of a real life, I guess, example other than a benchtop?
Yes, no, we all agreed at the conclusion of this that our goal would be to try this either on farm or an in vivo type experiment. So yes, I would like to see how that may interact differently, and especially using live feedback material if that would generate a different response. Does that answer your question?
Additional questions? No? Thank you so much, Rachel.
Thank you.
We are a little early, so I'm gonna wait maybe 5 minutes. So you can sit here with me. And I know it doesn't stress you out too much. So we are gonna get started. And our next presenter this afternoon is from Iowa State, and her name is Nikki Villalon.
Hello, my name is Nikki Villalon, and I'm originally from Southern California. I'm currently a third-year veterinary student at Iowa State University. And this summer, I did an internship at the Food Systems Fellowship under Dr. Madonna Benjamin at Michigan State University. So confirming that each piglet has their own functional teat enhances piglet survival. They confirm proper nutrition during early piglet growth, making pre-farrowing assessments critical for piglet longevity. So why identify a functional teat? Well, it's to enhance piglet survival and to reduce competition between the piglets. Parenchymal volume, measured as parenchymal distance, has been shown to determine the amount of milk available for the piglets. Stock persons will determine the number of good teats and allocate piglets to the sow based on the number of teats available. But despite its importance, limited research has validated the accuracy of stock person teat assessments compared to a test of teat functionality, the ability to access colostrum. Teats that were blind or did not provide colostrum were considered non-functional. Functional teats are those that provide access to colostrum at parturition. So the objective of this summer research was to, one, assess the accuracy of stock persons' visual assessments or visual teat count, good, compared to a hands-on assessment of a functional teat, functional. Secondly, it was to observe the morphological characteristics of both functional and non-functional teats. So prior to parturition, stock persons identify the number of good teats on 22 sows. During parturition, researchers identified the number of functional teats on those sows as 1, a teat that produced colostrum, and 2, it being not a blind teat. The materials that we used to identify or assess the functional teat was a paper mat to get inside the pen, a warm towel for udder stimulation, and a plastic cup to collect the colostrum. The materials for teat morphology, I used a ruler and a measuring tape. And then for positive reinforcements, I used treats like applesauce, and then in this picture right here, I used a hand scrubber to encourage them to lay down for me and for them to get more comfortable with me. On this left photo right here, you can see the paper mat that we used to get inside the pen for the assessments. For morphology measurements, first, I measured the parenchyma. The parenchymal distance was from the base of the teat to the lateral end of the mammary parenchyma. I used my hand to palpate the extent of the parenchyma prior to using the measuring tape for more accurate measurements. Next, I measured the samer, which is the distance from one teat to the other. I did these measurements on day 0 pre-farrowing, and then day 3 and day 10 post-pairing. So the results. We found a variation between good and functional teats in 9 out of 22 sows. The teats that were identified as non-functional at day 0 did not gain any parenchymal volume over 10 days. And the changes in parenchymal volume were not identified until day 10. And here is an example of a teat that is non-functional at day 10, and you can see compared to the teats next to it, the variation in the parenchymal volume. The greatest change in udder and teat morphology occurred from day 0 to day 3 compared to day 3 to day 10. First parity sows showed a greater increase in parenchyma volume compared to the multiparous sows. In conclusion, functional teat predictions differed in 40% of the sows measured. First parity sows showed greater variability and morphological changes. Integrating objective measures like parenchymal volume and colostrum flow checks into farrowing protocols can help improve piglet outcomes. So back to our main objective, why is it important that we identify what a functional teat is? That's because milk letdown is 10 to 15 seconds every 50 minutes, making teat access important. In this video here, you can see 2 piglets that have access to only one teat. This is piglet number 9 here, about to steal the teat from piglet 13. Poor guy. So the pros outweigh the cons. Each unfunctional teat mistakenly labeled as functional leads to the mortality and morbidity of 2 piglets. A functional teat labeled as unfunctional leads to a missed opportunity to foster another piglet. The problem? Stepping into the pen. Although it may seem cumbersome and takes a lot of time to do so, having accurate teat measurements or having accurate knowing which teat are functional at parturition can help with piglet outcome. It can help with welfare and to help with efficient stock person management. The solution? A low-cost disposable paper that can be used for in-pen assessments, making it easier, faster, and practical. In the end, every teat matters. And having practical tools like this, for example, that can help support making accurate teat measurements can help with piglet outcome and to improve herd outcome. I'd like to thank Dr. Madonna Benjamin, Amanda Jędrzejewska, Savannah Thompson, Dr. Bull, the Director of the Food Systems Fellowship, and USDA. I'm happy to take any questions. Thank you.
Thank you, Nikki. Any question for Nikki?
So you mentioned that 40% of the sows had a different value between the original visual score versus the functional score. Did y'all look at, on average, how many teats ended up not being functional?
Yes. Yeah, there was, I think there was, I believe, 8 teats that I found that started out functional and over time became non-functional.
So I know you only use 22 sows.
Yeah.
But do you think there could potentially be an application for expanding this for more animals and looking at a way to say, maybe we think by looking at her, she has a certain number of teats,
Right.
but maybe on average she actually has this many?
Yeah, absolutely. We are currently doing another cohort on this, and we're doing one more in November so that we can have more data. We're also having other people in Ireland doing the same study too, so we'll have some more people, some more data for this.
Very cool. Thank you.
Yeah.
Other question?
When there was a discrepancy on counts,
Yes.
were the farm workers more likely to assign more functional teats or less than what your measurements?
There was a variability. There were some that they identified less functional teats, but there were some that they identified more. So it was a little bit variable. Yeah.
A question of the Peterson.
Can you make any comments regarding the genetics of the sows that you that were in your study, and for the ones that you have enrolled to be measured in the future? Are those from the same genetics and different farms, or any information on that?
Yeah, so for this pilot study, they were based on the farmers or the farm staff used EPDs to choose their sows. They were all purebred Yorkshires. And I don't know what genetics or breeds are going to be used in the other study in Ireland, but so far it is kind of like the same genetics for this study at Michigan State.
Did you see any effect of the parity, whether older parity sows had more functional or unfunctional compared to younger parity sows?
There was no, I believe there were more unfunctional in the later parities compared to the gilts.
So I have a question. If I were to train a stock person, or looking at training and trying to improve those scores and make them more aligned with what you found, what would be your recommendation? What else should we tell them to look at so that we have a count that is more accurate?
Yeah, honestly, just checking that each teat is producing colostrum at parturition. Like that video or the picture I sent, let's see. Like that teat could have easily been seen as functional, but it was actually non-functional. So I think just checking at parturition at each teat that there is colostrum can help with that.
Questions? No? Thank you so much, Nikki.
Thank you.
Right, and our last presenter for this session is Emma Zwart from Iowa State University.
Thanks, Dr. Z. Can everyone hear me? Perfect. Awesome. My name's Emma Zwart. I'm a third year at Iowa State University, and this summer I had the opportunity to kind of work on a new feedback method in our farm, and I titled it Blue Goo and a Tube, and you'll see why it's blue goo shortly. So a little background on our feedback. Why do we give feedback to our sows? To build or strengthen the mother's immunity so that she can pass protective antibodies to her piglets. It's a very simple idea, but it's necessary to help control things like E. coli or other scour in our farrowing house. How is it typically done? In our individual gestation stall farms, it's typically poured on the feed trough or the feed in front of them in the morning when feed is dropped. In our group house sows, there are multiple ways that it could also be administered. With ones that have the feed trough yet, it is still poured over the feed. For those that have electronic sow feeding facilities, Typically, it's mixed up and poured on the slats or on the cement, which also poses a risk to human safety as the sows and gilts are excited to go consume that. So this raises a problem or is potential an area for better success. In previous work, Pearden in 2016 showed that ice blocks could potentially work. However, there were other confounding factors within that, such as the ice block melting too fast, or getting stuck underneath the fence, or getting pushed outside the gates, or who knows with the sows. So this led me to my objective, to investigate a novel tube-fed feedback protocol in group house sows for 1, effective delivery, and 2, animal welfare. In order to do this, I selected a Proposition 12 farm that had electronic sow feeding systems in place. I selected 8 pens, 6 were 3 weeks pre-farrow, and 2 were 1 week pre-farrow. They were a mixed parity ranging from gilts to P7s with an average of a P3. The average pen had 44 animals in, and 1 tube feeder feeds about 30 animals, and that was done on a pilot study prior to this study. The pen layout here, as you can see, has the 2 dark blue circles at the bottom, and that is where we place the tube feeders. The light blue squares are where they had access to water, and you can see the 4 electronic sow feeders and the 3 hospital stalls that were traditional in all of the 8 pens that were enrolled in this study. Then, as I have here, I have the actual feeder here if you do want to come check it out. But you can also see a picture. And at the bottom here, you can play with it, and that is how the sows or the gilts would play, and that's how they would get feedback material out. And we stored all the feedback material in the tubes. So that is how it was set up. Additionally, we zip tied them to all of our pens, so they had access from the alleyways, so no one had to climb into the pens to actually administer the feedback material. So then going into the recipe, we like to call it. So traditionally, feedback consists of intestine, feces, and water. So that's kind of traditional feedback material that you would see. I added in this 2 packages of underline gel. The underline gel served 3 purposes. 1, to extend the life of any pathogens that we may have in our feedback material. 2, to signify like a sweetener. And 3, to get the material into a gel-like material so it was not super liquidy to run out. Additionally, I added a bottle of Reload Pack to this recipe to help as an identifier. And this is what gets you your magical blue goo, as you can see in this picture. From there, after it was administered, I did exposure recording at 30 minutes, 1 hour, 2 hours, and 24 hours. Exposure was considered if there was blue on the snout or the nose and not anywhere else in the body. So I focused on the snout and the nose, but if they were blue everywhere else, that worked. And you can see 2 examples here with these 2 pigs. Additionally, I did lesion scoring to talk about the welfare or discuss if there was any other welfare. To do that, each pig was split into 6 sections, 3 each side, and count of a total of the scratches or lesions or any icky stuff, so to say, on the animal in each section. If it had more than 6, it was given a score of 1, and then all sides were totaled and given a total score out of 6. So for this animal, this would be, on this side, would be a score of 1 out of 3 total, and then if it was the same on the other side, it'd be a total of 2 out of 6. Going forward, the hypothesis I had was that 50% of the sows in the pen would be exposed to the feedback material within 2 hours of delivery. So here you can see me pouring in the feedback material into the tube, the sow playing with the tube and getting feedback material on her nose, and turning blue. This was one of my favorite growls. Additionally, you can see here there's more pictures of how this was used and what we would consider exposure rates and different blue tones on all the animals. And then here's a video that I'm going to play for you where you can see where the sow is playing with the button or the ball at the bottom and getting the material out. And then you can see where she's like, oh, this tastes good. I want more. So looking at our results then, so again, exposure rates were considered any blue on the nose, and we did that at 30 minutes, 1 hour, 2 hours, and 24 hours. The average at 30 minutes was a 37%, 47% at 1 hour, 51% at 2 hours, and 72% at 24 hours. Zooming in then on that 2 hours, which is what we set our hypothesis against, we saw that 51.4% of the sows were exposed, which was not significantly different from our theoretical expectation of 50% with a p-value of 0.7. Additionally, looking at the lesion scores, I found there was no significant difference between pre- and post-feedback lesion scores with a p-value of 0.3. This graph may be a little confusing, so I'll try to walk you through it to the best of my knowledge. So everything within that crosshairs is where a lot of the data was concentrated, and you see the 3 at the top. Those were probably 3 that did have more lesions, but I want to remind you that's 3 animals out of 150 that were in this study. Going into our discussion, there's a few limitations that were in this study, 2 of them being temperature and timing. I did this late July when it was really warm out, and feedback was given at 11 a.m. Both are time confounding things when sows are maybe not the most active and willing to get up to go investigate something new in the pen or consume the feedback. Additionally, another limitation was the subjectivity with lesion scores. I myself did all the lesion scoring with help of one other person. That one other person was different between the 2 times, and so there was some subjectivity within that. Looking to the future, one thing to be considerate of is desensitization if we would leave these in the pens for like 24/7. Would they still be interested? We don't know because that was not part of this study. Additionally, what is the longevity of this equipment? As you can see with the picture here, the tube kind of came disconnected from the actual feeder overnight. Is that normal? Is that not normal? Also, we had to use a PVC pipe because our actual tubes did not ship in time. So this is a retrofitted way to also make it work. Additionally, seasonality. I did it in the heat of summer. What does winter look like? What does spring? What does fall? Does varying weather change anything? I also did a cost breakdown to kind of compare what was traditional and what the new tube feedback system may look like. So the current protocol of pouring it on feed is about 4 pounds of gestation feed, which gives you about $15.60 for 30 animals. Using the tube feeders, you have the upfront cost of $155.98 for the ball and the tube itself. But when you look at just the underlying gel packs and the reload, you would have a total of $39. And that is what is the recurring cost of this study. And then overall grand total of that would be $195. Again, the feeding tube and the ball are an upfront cost. But I do want to compare that to one stat. And that was the average workplace injury in a swine facility was $3,400 according to the National Pork Board in 2017. That's the most newest data I could find on reporting of this at the time. And I would just like to say, when you use the tube, you don't have to get in the pen. There's limited human risk within that. And so you're saving money by not having that risk of potentially having a workplace injury, such as blowing a knee out when a sow tries to take you out. In conclusion, I found an effective delivery of feedback material in group house sows. Animal welfare was not compromised as seen by the lesion scores and simple observations throughout the study, and was an improvement for employee safety. I would like to thank Dr. Rachel Jensen, Dr. Kara Hayden, and Dr. Carly Bates for helping me at Pipestone this summer, and Dr. Errol Holtkamp and Christine Maurer at the ISU SFIT program for their guidance in this project. With that, I will take any questions.
Questions for Emma?
Thank you for the presentation. Is there anything, or did you measure if 1 or 2 sows that were first to the device, would some of them just empty it? Or was there something safeguarded to parse it out over 24 hours?
Yeah, thank you for that question. So on the feeder mechanism themselves, it has the red dial on there to set how wide open or how closed it is, and we had it set really tight, so they had to work at it. And so that was to help kind of mitigate one sow getting there and just eating it all. In addition, once one got there, we found that we saw 2, 3, and they slowly started making their way more. And so our hope was that they would eat some and then go tell their friends in the back of the pen, and they would come up. And we did see some of that where they would get it, they're like, okay, now I'm gonna go eat, or I just ate, I'm gonna come get some, and then I'm gonna go lay back down. By having it in the front of the pen, we were able to kind of help aid in that, like, it's not where they're resting, it's more of an active area.
So at 24 hours, you had what, 75% or so
Roughly, yeah.
exposed? Do you think there could have been anything done that could have impacted that number, or is that enough for exposure?
So this was a one-time, one day that we measured this, and per the Pipestone protocol, what we followed, they do it 5, 3, and 1 week pre-faro. So we found that 75% or roughly 75% exposure after 24 hours, if you would repeat that at that same protocol, would be sufficient. Additionally, if the pig would consume it and shed it, she's shedding it to her pen mates as well, and so it's also increasing that exposure.
So building off of that question, are you saying that you repeated this multiple times within the same pen and you saw different sows come up each time? Or were you more likely to see the same sows return to the spot each time?
So with our study, we did one time per pen, so we did not repeat it in the same pen due to just the time constraints of the study. And I would perceive that one figured it out the first time, she's gonna be even more excited the second time we bring something in. And we did talk about training them in terms of something we might want to do, such as putting Jell-O in there at time of mixing to help reduce any fighting or boss sows. And then additionally, if we're seeing any tail biting or anything like that, you could also use a feeder for something like that.
Other questions?